you. Good morning. Hello, I'm Laura Shaughnessy. I serve as Chair of the Professional Counselor Advisory Committee for the Kansas Behavioral Sciences Regulatory Board. Today is Thursday, October 2nd. I ask the members of the Advisory Committee to respond to a roll call to signify their presence at this open meeting that's being conducted remotely by conference call and other electronic medium. Jim Kilmartin.
Present.
Chow. Melissa Briggs.
Present.
Good morning.
Good morning.
Amanda Brown. Don't hear her. She there?
I don't see her on the Zoom.
Okay. Michael Countryman.
Here.
Thank you. Good morning. Samantha
morning.
Holloway said she'll join in a little while. She's not here yet.
That's correct. Yep.
Thank you. Jason Lee.
Here.
Good morning. Hello. Masha Magsudi. Don't see her, hear her. Vanessa Perez.
Here. Good morning.
Good morning. Hello. Amanda Petrick Gardner.
Present.
Good morning. Hello. Amanda Wade.
Present.
Good morning. Hello.
Morning.
I note the following BSRB staff member also present. David Fye.
Here. And
Okay.
Leslie may be joining us a little bit later in the meeting as well. So.
Great. Terrific. Next, David will read a message concerning this meeting being held remotely.
Thank you, Laura. And Amanda Brown did enter as we were going through roll, so she's in attendance here as well.
Good morning.
Sorry, I
Amanda.
was late.
That's okay. Good morning.
Well, my name is David Fye. I am the Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the Advisory Committee to address any concerns, but the Open Meetings Act, or the COMA, does not require the Advisory Committee to provide public comment or answer questions from individuals. Although individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and also by other electronic media, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the meeting on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the COMA are not suspended. Therefore, we will be conducting this meeting pursuant to the COMA. On August 20th, 2025, we sent notice of the Advisory Committee meeting to all individuals who requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the conference call line, but if I hear someone beep over and introduce themselves, I will let you know.
Terrific. Thank you so much, David. Okay, the meeting is now called to order and the Advisory Committee will begin its discussion of the first item on its agenda, which is, of course, agenda approval. And as you look at this agenda, does anybody have any questions or anything to add? And if not, I need a motion to approve the agenda.
Laura, I was just going to point out on the agenda for today for October 2nd, it also says the next meeting is October 2nd.
Yeah, I saw that.
Okay.
Yeah, thank you for that. Okay, so we can change that.
Yes, and that will be in December, and I can pull the date here. The date for that December meeting will be on, it looks like Thursday, December 4th at 10 a.m. So we'll update that on the official copy.
Yeah, that's what I have. Okay, so December 4th, 10 a.m. Thank you for that. Anybody else have any questions or changes to the agenda? Okay, so I need a motion and a second to approve the agenda.
A motion to approve.
Thank you, Vanessa.
I'll second it.
Hmm.
Amanda Brown.
Well, thank you, Amanda. Okay, we have a motion and a second. All in favor, say aye.
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 Opposed, same sign. Okay, the agenda is approved. Thank you for that. The next thing, approval of the minutes from our August 4th meeting. You have your minutes, and does anybody have any questions or changes? And if not, I need an emotion and a second to approve the minutes. Okay, I don't hear any changes.
I'll make the motion to approve our minutes.
Thank you,
I'm
Michael.
second, Jason.
Oh, great. Thank you, Jason. Second from Jason. All in agreement, say aye.
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 Okay, approved, same sign. Okay, approval of the minutes has been accepted. Thank you for that. Okay, our executive director's report, David Fye.
All right, thank you, Laura. We'll go ahead and provide some updates, and I'll go ahead and start with some legislative news. So every year, the legislature in Kansas meets for the first few months of the year. Usually they try to hold to about a 90-day session. However, the timing of those 90 days can differ based on the year. And so sometimes it goes as late as April, or sometimes as late as I've seen June. But that is when the legislature really hears bills and does most of their work as a body. However, in the off months, there are interim committees that meet. And so this summer and fall, there were a number of committees that talked about some health-related topics. I would encourage you all, if you have not, I would encourage you to become familiar with the legislature's website for Kansas. It has a lot of good resources on the website. Additionally, if you are not familiar with the legislature's website, you can also use the legislature's YouTube channel. They broadcast all of their committee meetings and actually floor action as well. And so during the session, that's really helpful to kind of follow what's going on. And then when the session is not going on, you can follow those interim committees. And the agendas and also testimony from those committees is posted on the legislature's website. And you can kind of follow that by day. But I wanted to put a spotlight and highlight a couple of the committee meetings that met this interim. A number of them are on a number of different health topics, like the Medicaid waiver waiting list for intellectual and developmental disabilities. And there's been some talk about contract staffing for nurses, especially with the new state hospital opening up in the future. But there were two committee meetings that I wanted you to be aware of. There was a special committee that was a House committee this interim. It was called the Special Committee on Government Oversight. And what that committee met to review was a lot of the operations for the Board of Nursing. And in preparation for this meeting, the Legislative Research Department had actually requested some information from our office, and so we provided information. But it was about some of our processes when someone's license is about to expire, some of our procedures to reinstate a license and renewals and those kind of operational aspects. The meetings that have included the Board of Nursing basically reviewed a lot of the performance measures for that agency and also went into some detail concerning their complaint and investigation process. As you know, a lot of the work that we do here in the office involves licensing of practitioners and helping applicants, but we are also charged as a public protection agency to investigate complaints against practitioners, and so that's a very important responsibility we have as well. And similarly, the Board of Nursing investigates complaints against nurses. And there were some questions about some of the disciplinary orders that they had agreed to with some individuals who had previously been licensed that through some different circumstances were no longer licensed and then were basically having found to have continued to practice after their license expired, and then some of the details there. And there were a few different situations, but some of those individuals came before the committee and talked about some of the difficulty they've experienced after getting those disciplinary orders. Some talked about their malpractice insurance having increased. Some talked about difficulty finding jobs. And so they went into some of the details of those orders, and they did this all publicly at the meeting. So I'm not sharing anything that can't be shared, and you can go back and actually watch and hear that testimony. But I think it did call into question some of their procedures for their agency. They talked a little bit about, do they give sufficient notice when someone's license is going to expire so that they have a good opportunity to renew? and are they informed, properly when their license does expire and what that actually means in terms of what they can and can't do. And then how difficult is it for someone to get their license back after their license expires. And so while it didn't directly involve our agency, of course, we are monitoring this information. We want to be thinking about it in terms of, are there things that we can learn from our processes in a state that, we believe are, in a good justifiable position? And can we learn from those meetings and some of the legislative tone from some of those things? And so just to let you know, one thing that they were critical on for the Board of Nursing was when someone's license expires, they send a paper postcard about 90 days out, and then they only send email reminders if someone is signed up for voluntary service to receive those email reminders. For the BSRB, we send email reminders 90 days out, 60 days out, and then 30 days out. And then if you do allow your license to expire, we mail you a letter that says your license is now expired. Here's what that means. You should not continue to practice under the scope of practice that would require a license. But if you do want to practice again, you would need to request reinstatement of your license, and there is a process for that. And so we do have a different process. And one of the people who was testifying in front of the committees did it was an interesting situation because she was a nurse but also an addiction counselor under the BSRB, so she held dual licenses. And while she was critical of the Board of Nursing, by comparison, she highlighted our agency and said, I don't think the Board of Nursing gave me adequate notice about the expiration, but I'm also an addiction counselor and they send out 3 emails. And so, I was happy to hear that, our processes by comparison, I think are in a good position. And I also think that letter that we send out was different than what they do as well. So I think our way of informing people that their license has expired and what that means, I think, is in a good position. But I do think the legislature is looking at disciplinary processes in general and investigative processes for state agency. And so when I talk about some of the items from the recent board meetings, I'll kind of talk about the board's review of our own investigation policy for the agency. So I'll get into that a little bit later in my report. But I would encourage you, the first meeting, the tone of that meeting, especially from some of the members of the committee, was very stern with the Board of Nursing, and there was some unhappiness with some of the things that they were perceiving from the agency. I will say the agency's hands were tied a little bit during that first meeting because one of the cases was involved in active litigation. So while the person who was coming before the legislature could share whatever information they chose, the board believed it was, limited in what they could share because of it being active litigation. So there were some circumstances like that. And of course, when we're talking about an investigation, often if we get a complaint against someone, there is maybe tons and tons of documents and other records that we had reviewed. And not all of that goes into the final order, and not all of that is publicly shared when the disciplinary order is posted. And so in some cases, there may be a lot to the story, but in a limited period of time, you hear a snapshot view of it. But I do think that we have a duty to review our processes and make sure that they are defensible and make sure that we're doing things right. So we'll talk about that a little bit more. But I do wanted to highlight those two. The second meeting, I understand the tone was a little bit different, but there was still concern. And it would not surprise me if we see potentially some legislative action somehow in the area of investigations or disciplinary procedures for state agencies. So we'll monitor that. And of course, we'll continue to try to do our best to meet the expectations of the legislature and make sure we're protecting the public. So moving to some, like I said, board activities. I try to keep you all informed of relevant items from recent board meetings. And since your last meeting in August, there were 2 board meetings. There was the regular full board meeting, which took place on Monday, September 8th. And at that board meeting, one of the relevant items that I want to keep you updated on, the board is going through all of the unprofessional conduct regulations and recommendations from the advisory committees, and is going item by item to try to see if there is some standard language that they can adopt across professions, or some of those recommendations that were forwarded by the advisory committees, they're considering those two to see if those should be in the regulations going forward. So they're continuing to work on a section of those at a time, and they'll go through those until they're all finished. and then they'll revisit their recommendations and then put those out for that language to be reviewed by the Department of Administration, then the Attorney General's office, and once it's through those channels, then it'll be out for public comment. But that should be probably sometime early next year based on the progress of the board on those. There was also some discussion about the Complaint Review Committee of the board using a tool put forth by an agency called EBOS. EBOS is an entity, is a private company that provides regulatory boards like the BSRB with additional tools for their disciplinary councils. So basically, right now, some of the resources available to the board, if there is a disciplinary violation, would be things like additional continuing education hours required, or supervision requirements, or up to a fine or suspension. What this company does is it really specializes in certain areas and helping practitioners if they need more education or redirection in a certain area. So if someone is found, for example, to have a confidentiality violation, what this company might do if it's asked to provide services would be to walk the person through some additional training on confidentiality and then have them demonstrate that additional knowledge and training by either taking some tests on confidentiality and then having those graded and go over that with their experts, or have someone essentially write a paper on confidentiality and then have that reviewed by experts and then have them go through this. The goal is that when there is a disciplinary finding, in a lot of instances, it is an opportunity for that practitioner to learn from that and hopefully to become a better practitioner going forward. And so by using these tools, you are holding the person accountable, you are protecting the public, but you are also trying to help this practitioner be a better member of the profession going forward. And so the board was supportive of those tools being utilized by the CRC, but did authorize the CRC to go ahead and meet with that company to collect some more information about some of their processes. And then there was also a discussion by the board on perhaps adding some language to either the statutes or regulations on notifying clients when a practitioner is under direction. There is some language where if someone is practicing under supervision, they have to notify clients. But in certain instances, someone is able to practice under either supervision or direction, and we don't have clear language that really puts under direction in the same category. So the board expressed an interest in doing that, and we're going to be reviewing our statutes and regulations to see where that would make sense to be added for clarification. Moving next to the board's out-of-town meeting. This took place on Monday of this past week, so just a few days ago. But once a year, the board likes to have an in-person meeting and have as many board members as possible all come together in person and really go through things that require more in-depth discussion and talk about some different items, perhaps for the legislative agenda for the board moving forward. And so the board also likes to move this meeting around the state. So if there are individuals in different areas, they have an opportunity to attend a board meeting in person if they're not here in the Topeka area. So a few years back, we held this meeting in Kansas City. We have held it in Wichita. Last year, it was in Lawrence, and this year it was in Manhattan. And so this was a meeting that we had and took place. We gave the board some updates in terms on licensing, the budget, some overview of recent trends as far as the investigation totals. And then we gave some updates on multi-state compacts, and then a little bit more information from the survey of licensees. We discussed a little bit of the legislative meetings where they were talking about some of those issues I highlighted earlier in my report. And then we talked a little bit about the future of the agency. So since I have been with the board, I came on as executive director back in November of 2020. So we are just about a month away from me being here for 5 years as executive director. And as I've worked with a lot of different associations at the national level and other organizations, some of those entities have a strategic plan, which really maps out sort of not just the current priorities for the agency or association, but it also talks about sort of what the members of the board or committees view as the priorities moving forward. And so we presented some information on how to develop a strategic plan for the BSRB, and then we allowed some, board member discussion and feedback, And it was the position of the board to go ahead and start taking steps towards the creation of a multi-year strategic plan for the BSRB. So this will be something the board will be spending a little bit of time working on at each board meeting, going through a SWOT analysis, looking at, the mission and vision and core values of the agency, doing an internal assessment, looking at our strengths, weaknesses, opportunities, and then going through and looking at goals and objectives, and then figuring out some ways to monitor and what to put in place for the future. So I'm really excited about this, really looking forward to working with the board members on putting together a multi-year plan for the agency, and collecting some additional feedback on some of the priorities for the BSRB. There was also at that meeting a review of the items for legislation coming up this next session. Previously, in the fall of last year, the board did discuss a few different topics, and there was support for a few items to move forward in legislation. But due to a few unusual factors and the pace of the legislative session, our bill was not able to move forward during the 2025 legislative session. But we went through those items to see if the board wanted to continue to move those items in the 2026 legislative session, and the board was supportive of those items. So just to kind of highlight a few of those, one of those items was there's an expansion of our existing temporary student licensed addiction counselor program. This was something that was set up. It was initiated by the board back in 2023, put forward as sort of a pathway towards an addiction counseling license, where someone had 60 hours towards a 4-year degree, and you had an emphasis in addiction counseling or a related field. And somebody would essentially have an agreement with their school and with an employer to finish the remaining hours while they're working towards an addiction counseling license and the completion of their 4-year degree. But they'd be working under supervision, and they'd have some other conditions as well. And so the board was encouraged to expand this to some additional individuals who could qualify for that, including some people that are in graduate level programs. And so, so that is going to be something the board is going to be asking the legislature to expand when the session begins. There was also some vague language in the practice acts for both addiction counseling and marriage and family therapy. There is a statute in each one of those practice acts that basically is kind of a carve out. And so it says, for almost everyone practicing services in this area, you would need to be licensed. However, this is not meant to restrict the ability for, and then it says like students in an academic setting to be able to do some of these type of activities. But accompanying the students or intern language, there was also some language that talked about individuals preparing for the practice of addiction counseling or individuals preparing for the practice of marriage and family therapy. And that term is not defined, and it creates kind of a vague standard. And so the board was supportive last year of removing that language just to, resolve the issue of the ambiguity. And so the board confirmed they were still supportive of removing that language from the statute. There was also a discussion that your advisory committee had last year about supervision of individuals. And currently, right now, there is some language that allows for someone outside of the professional counseling field to provide supervision as long as they are a board-approved supervisor and there is an extenuating circumstance. But there has been sort of a real push by employers saying that they would request additional flexibility in who could provide supervision hours towards pursuit of a clinical license. And if you recall last year, there was a lot of discussion about that in the advisory committee to see if there could be some sort of a compromise position because, there was a strong desire for professional counselors to receive supervision from professional counselors, but there was also a strong push from the workforce aspect in terms of increased flexibility. And so ultimately, the compromise position was to request some statutory language, which would say for individuals that are accruing those 100 hours towards a clinical license, at least 50 of the hours have to be by someone who is a board-approved clinical professional counselor. And then the other 50 hours could be someone who is also a board-approved clinical professional counselor, but upon request, 50 of the hours could be someone who is a board-approved supervisor, but maybe from another field under the BSRB at the appropriate level. So It was an attempt to get a compromise so that it would make sure that half of the hours at least were still from a professional counselor, and then half could be from someone from another field. So that is the language the board has agreed to move forward for this session. And so I just wanted to remind you of all this conversation that took place last year. And then the last item in that bill was basically to add a 13th board member, and that would be to add a behavior analyst on the board. Currently, the BSRB regulates 7 professions, but when the behavior analysts were added to the board, the statutory language that talked about board membership was not adjusted. So there is currently a member of the board for each of the other 6 professions, but not for behavior analyst. And if you track the growth of licensing over the last, what would that be, about 9 years since we started licensing behavior analysts in 2016, their numbers have really grown. And I think now between the 2 levels of licensure, I think it's somewhere between 500 and 600 individuals. So there are quite a few behavior analysts licensed in Kansas now. And so the board did recommend adding another member to the board for behavior analysts. And then there was a discussion over the board's investigation and disciplinary policies. I think some of the things that the Board of Nursing was criticized for in those legislative meetings was that some people who came before the committee basically said that they felt like they didn't understand the process, or they felt like they may have been pressured into an agreement. I think what the issue is for people that don't have a legal background, there can be some confusion about the different terms that are used during the investigation process. There are things that are sent out. Some of them are called consent agreement orders, and sometimes they are called summary proceeding orders, and there is a difference. I think one thing that I'm really proud of our board for doing is several years ago, before my time, there was an investigation policy that was drafted with the assistance, I think, of legal counsel and the board, and it was posted on the board's website under the policies section of the board. And about a year after I started, we did a big cleanup of that document to make sure that the language still looked good. And that policy continues to be posted. So we have a policy that really outlines in what cases the board will respond to complaints, the requirements as far as, whether they can be anonymous or not. We don't do anonymous complaints, that they have to be in writing. It does talk about the group that oversees the investigations. It talks about the members that serve on the complaint review committee and the makeup of that body. It talks about the process of, when we receive a complaint, we notify the licensee, we collect information, there's back and forth. It even talks about the types of orders that can come forward, like the consent agreement orders and summary proceeding orders. So I think, at least in terms of where the agency stands, in terms of some of those questions and criticisms, maybe by the legislature in terms of other agencies' processes, I do think that we are in a good position based on the information we have out there publicly available. And that's not to mention the other information we have on our website. We have some frequently asked question information as well. So all of that is available when people file complaints. They can read that as well. So I think we're in a pretty good spot there. But we also walked through with the board to see if they wanted to make any changes to that policy. And I think there were some minor adjustments the board did recommend. One of those was to add a new member to the complaint review committee. So currently right now, 5 of the 12 board members serve on the complaint review committee that meets every other month. And there was a recommendation to add a 6th member of the board, which would mean that about half the board would serve on the complaint review committee, which would be increase the ability for members to rotate into those positions and get some experience seeing that side of the BSRB, which I do think is a great exposure. It is a lot of work. There's a lot of reading that goes into it, and I've personally seen the board members that serve in that committee, and I know how much they work hard to do their job to be fair, to make sure that they're protecting the public, and also make sure they're following all the processes when it comes to licensees and making sure they're not being overly strict, but also holding licensees accountable when there are some issues. And so that'll be a change we'll make going forward. At the next board meeting, there will likely be another appointment to the complaint review committee, and then we'll have 6 members going forward. But I think that concludes most of what the group was able to meet about at the special board meeting and also the regular board meeting. And like I said, just wanted to highlight some of those legislative items. So I think at this point, I'll go ahead and end my report and see if there's any questions over anything that I discussed or any other matters.
Thank you, David, for that report. So does anybody have any questions or feedback for David? I can tell you that it was a really productive meeting. We went through so many important things that I'm so grateful we had the time to take and really talk about. David, when you talk about, anonymous complaints, that is one thing that we didn't dive into, but we said we'd dive into it another time. Um, that's something that we might bring up back here. I'm not sure. I really had an appreciation for, comparing how we work with other boards and how statewide and nationwide. It gives me such an appreciation for how we're structured and how we do what we do. Um, I always feel prepared for what's coming our way when we have a big comprehensive meeting like what we did. I feel like, the next year, the things that are going to happen in the next year, the stage has really been set for us to tackle them in a very comprehensive, well-informed way. So thank you for all the work you did to put that meeting together.
Well, you're welcome, and I agree. I thought it was a really productive meeting.
Mm.
And yeah, I appreciate what you said as far as, being informed about things. And I realize that some of my reports are a little bit lengthy, and I tend to fall on the side of trying to over-inform because I would want someone to do that for me. But I also realize, in terms of these national meetings that I attend and sometimes members of my staff attend, it's a unique opportunity, and it's the ability for us to collect information from people in lots of different states and to kind of learn from their best practices and learn from areas in which they encounter difficulty. So I am so thankful that the board is supportive of us having a role at a national stage to collect that information and bring it back. So,
Does anybody have any questions for David about anything he reported on? I have one question, David. What is your actual net credit service date? What date did you start with the BSRB?
that's a great question. It's somewhere around November 15th, when the previous director, Max Foster, was retiring. He was able to get approved the ability for us to work together for about a month and a half. So we worked together from about November 15th through, I think, that first week in January.
Okay,
And so I think it was somewhere around there. I can get you an exact date, but it's somewhere right around there,
in November.
in November. Yeah.
Okay, just curious, asking for a friend. Um, Anybody else, any other questions for David? Okay, if you ever have them, be sure and reach out to him, reach out to me. Something comes up, if you think of something that you heard about that he covered in his report. Shall we move on to updates on the compact?
Sure. And do you want me to start on updates or would you like to?
Well, I'll deliver the fun news.
Okay.
There isn't any, there's no not fun news. The compact is starting to roll out. I haven't checked in today, but Arizona and Minneapolis were set to go live 2 days ago. And so it's starting to happen, which is very, very exciting. I'm gonna go check tomorrow and find out how things are going in those two states and if it actually happened. And now David will talk about what we're doing to get ready for Kansas to come live.
Yeah, thanks, Laura. It is an exciting time because what they had originally said is they said, we're not going to have a minimum number of states before we launch the compact, except that there'll need to be two. So as long as two states meet all the qualifications and are ready to come on board, they'll go ahead and launch it. And then when other states are ready, they can go ahead and join, and they'll just add them to the portal as well. In Kansas, it's a little more complicated. And this has to do a little bit with some of our requirements for licensure that we've had in place for many years, and then also working to kind of come under compliance with the terms of the compact. So Kansas has not required a background check for licensure, and there are certain reasons for that, but these multi-state compacts have included that as a requirement. The first compact that we had joined, SIPAC for psychologists, we joined that, and there is a requirement for background checks. But what SIPAC did is they set a precedent where states would have 10 years to come under compliance with the background check requirement. So you'd have your members be able to practice under the compact, but in the meanwhile, the state would need to be taking steps towards making that a requirement. What professional counseling did, and it's a different group of commissioners, so they do have the authority to do things differently. They kind of, in my opinion, broke from the precedent of SIPAC and said, this is a background check as a requirement, but what we're going to do is we're going to say any states that don't have that as a requirement can't participate until you do have that as a requirement. So that is unfortunate. It does mean that our practitioners wouldn't be able to practice under the compact until we're able to get that all resolved. And that's why we're working so hard to get that put into place this fall, and have people given the opportunity to opt into the background check requirement. There was also a requirement for the compact that individuals needed to have a 60-hour degree, whereas some states had allowed a 48-hour graduate level degree. But under the compact, it does require the 60-hour degree. And so the compact had a choice on this to ask states to go back and verify that everyone did have the 60-hour degree. But they made a choice that basically, if anyone had a license at the time that your state passed the legislation, they were fine. And so they allowed grandfathering in of all the people, but anyone who obtained a clinical professional counselor license after the date that the compact became effective, which for Kansas, I believe it was July 1st of 2024 or 2023. Then basically we just need to verify that those individuals have a 60-hour degree, or if they don't, we need to tell them that they don't have it. And so those are the two markers that we're putting into place in our licensing system. The background check is really the biggest one because we're trying to move forward on that for all professions right now. But once we have those two things in place, then we should be able to join the compact. I don't think there's anything else that would be in the way. And just as a reminder for this compact, for professional counseling, it does relate just to the clinical level of professional counselor. I know we do have a lot of individuals at the LPC level, but they would not be eligible unless they reached the clinical level of licensure. So just as kind of an update for Kansas, we are really interested in moving into having this active in Kansas as well. But because of the way the compact decided, the background check issue, and our preparations for the 60-hour verification, those are the two things that we need to get put in place first, and then people will be able to start practicing under the compact. Now, under this compact, you will be able to essentially apply for a privilege in other compact states. But right now, I think if you did do that, you would probably only see, I think, Arizona and Minnesota, if those are the two that entered. So if for those that are early adopters, there may not be a lot of opportunities to get privileges in other states. But hopefully over this fall, as more states join and become active, then you should have more opportunities. And I would say at least over the next year, we'll probably see a majority of the states meet the qualifications and then come on board. So.
Great, thank you for that update. How do you have a timeline for the FBI background check to be live in Kansas? Any idea?
I don't, because I'm still trying to get final confirmation on whether this is something that we need to have a regulation put into place or whether it's not. And we're still investigating that, trying to figure it out. But if it remains the only item and if we could put into place an emergency regulation, there may be a way that we could submit that. That's kind of rare, but what it would allow entities to do is put something into place that would need to be followed up by a permanent regulation within 3 months. So if we have everything worked out, normally that process does take quite a while to go through all the different levels of checks, but that is a way that we could get that into place a little bit quicker. So we are ready to do that if that is something we have to do, but we're still trying to figure out what is required and how we do this. It's kind of a difficult process, and not a lot of states have made that step recently. So
if somebody wanted to, there's a chicken and egg here thing in my brain. If somebody wanted to do their own background check or submit their own background check without it being part of a temporary or permanent statute, would that let them get that done? No.
No, unfortunately not. It has to be part of the licensure process, and that's
Okay.
kind of the difficult thing too, because the normal statute that talks about background checks talks about essentially when you do an application for licensure or to reinstate a license or as part of an investigative process. So it doesn't really envision what the compacts are requiring in terms of an opt-in. So that is something we're trying to work into because it's not like you're getting a new license under the compact. You're really just trying to meet the qualifications so that you can practice under the multi-state compact. And so it's taking laws that don't really necessarily blend perfectly and trying to make them all make sense together. So
Same thing with the 60-hour degree. Could somebody submit that and say, even though it's not part of the, it's not official that it's necessary yet, because that sounds like that might be a regulatory change. Can someone submit their degree and say, I have 60 hours?
well, and we have a record of that. So
So
that
that's really just data that we have
that's
to.
just, yeah, that's partially we're working with our vendor to get a marker put into our system.
Okay.
So that's more of a minor concern. The background
Okay.
check is really the big issue. The other one, we're going through the process of, having our licensing system updated for that marker, and then we'll be providing a list to the compact as far as who's all eligible.
Yeah.
But the background check is really the big hurdle right now. So
Okay,
yeah.
that makes sense. Okay, thank you for that explanation. Any other questions for David about the compact? Okay, well, if any questions come up, reach out to him, reach out to me, and we will get them answered for you. Okay, it sounds like we're moving to old business.
Okay.
Continue.
Do you want me to go ahead and
Sure, go ahead, I'm sorry.
that's okay. So as you recall, we had the survey of licensees that we have done this year, and you have a copy of the report in your packet.
Yeah.
The report is something that we have gone through in a few different meetings, but it's a lengthy report and there's a lot to it. And so, as a way to help the advisory committee kind of work through this, we had asked members to focus on a couple of questions so that we could kind of divide and conquer the subject matter. And so, in preparation for this meeting, we had asked you to focus on two different topics. The first was a question that dealt with whether practitioners had seen any negative issues in the area of telehealth in the last, I believe, 2 years. And then there was also a question that talked about, do you use artificial intelligence in your practice? And if so, how do you use it or what are you currently using? And so you should have that in your materials. And I do really want to hear a lot from each of you as members of the advisory committee because we have the report. And for that first question on telehealth, I believe the summary information is on page 16. So I've had my staff go through and try to summarize most of the open field responses. And then the appendices has the open field answers from page 59 through 69. And then for the artificial intelligence, the summary information is on page 19. And then the open field responses are on page 80 to 86. But I would like this conversation to kind of be driven by most of you because as licensees and practitioners, I'm really curious, what struck you personally when you were looking through the summary information and when you were looking through the open field responses. Did something surprise you? Did you see sort of a trend of responses? Were you struck by maybe the tone of some of the responses, or was it different than what you expected? So I'll go ahead and start with that. And why don't we go ahead and start with the telehealth question, and then let me know if what your thoughts were on the telehealth question or the survey responses on that topic.
Okay, anybody feedback around this topic?
I feel like there's kind of a similar theme between both the questions in the sense of like it's change and adjusting to new technology and a different way of doing things. I mean, humans don't always love change. And so it does seem like some people have kind of embraced it while others are a little bit more resistant to that change. And so there's definitely going to be a learning curve or kind of some stumbling blocks as we adapt to needs of our clients and our society for sure.
For sure.
I'll share. And I know I'm one that's biased because I'm 100% telehealth, but I think probably just needing to see provide more education on the research about telehealth and the effectiveness, and that they show that there's just as much uh, good and quality in treatment as telehealth. I mean, all the research I've seen and read so far shows like it can be done just as well. Because I mean, we can see it was kind of a lot of people saying, "Oh, it's just fine," and some people saying, "No, I think it's lazy. You can't build rapport that way." And so I think that just kind of showed like we just need more workshops or education spread about that.
To expand on what Amanda just said, one part of the training that I would strongly encourage, and we start doing this in our practice, is for people to have training on the ethics and confidentiality related to doing that remote treatment. And the reason we've done that is we've just noticed that people have become a bit more relaxed when they're doing that remote treatment, and they overlook some important details and making sure they're being confidential. The other thing that we've learned, and again, it kind of goes off what Amanda's saying, is some practitioners are not good with remote at all because they just don't connect. And then we have some practitioners that are much better doing it remote. And I don't know if I'm not trying to be stereotypical here, but I don't know if it's an age thing or what you're used to, but we have one practitioner that just does an amazing job remote, but she's not as effective in person. I can't really explain it. So that's kind of the reverse of what we would expect. So
Is she aware of that of that difference?
she is.
What does
And
she say about it? What does she attribute that to?
I think if she, and I'm speaking for her, so it's a little unfair, but I think what she would describe is that she's less anxious. She just has, I think it's what she's used to. And the way I became aware of it is I noticed that um, her no-show rate declined when she was doing it remotely.
Interesting.
And so I approached her and just asked, what's different? And it was the telehealth. She was doing it remotely. And so I think it's almost becoming it's your personality and what works for you. And then I have some other professionals that they don't like it at all. And we find that it doesn't work really well with little ones, with children.
Sure.
So.
Makes sense.
To kind of piggyback off of what Amanda said, I think that it is the idea of just being open to it. Within my practice, I have a little bit of in person, a little bit of telehealth, and a little bit of clients that do both. And I don't notice a difference in the sessions.
Wow.
I feel like the quality of the sessions across the board is the same. My clients that come in person sometimes and telehealth sometimes don't tell me that one is better. I have clients that live locally to my office but choose to do telehealth just because then they don't have to spend the time driving. And so I have seen it be what the research says, which is that it can be equally as effective as in person. And so I do think that we do have to educate across the state because I just feel like we're the state that needs it. There isn't providers everywhere. Like we are the location that needs to be able to provide this because I think there are a lot of people in rural areas that don't want to see practitioners in their tiny town. They'd love to see someone that they're not going to see at the grocery store twice a week.
Right.
And so I do think we have to educate on that.
Well, it's also a mind shift of the way we think about treatment because historically the clinician tells the client what they need. And we're changing that mindset to where the client defines their treatment. And some clients request and would prefer the telehealth and some prefer in person. And I think that we need to be willing to adapt that in their treatment plan of what works best for them to have the best outcome and success for them.
Sure. I use telehealth for continuity. If someone can't get here, if they're, if they can only get here a couple of times a month, let's do telehealth the other time so that we have continuity. It was real interesting reading the open comments in the survey. Most of them were, I don't have any problems. Most of them were, I don't have any problems, which I thought was, that's encouraging. A few things about, payment and reimbursement and, tech savviness of clients and so forth. Of course, those are kind of, those make sense that those would be there. Any other feedback about this topic? Can someone share the data that they have that about telehealth being as effective as in-person counseling? Would someone put that in an email that we can send out to our team for those who don't have it, including
I
me?
can. I have it in research, but then I also have it. One of the textbooks, whenever I was getting my PhD, actually stated it. And so I can send you the name of the textbook too.
Please, please,
Yeah.
please.
I don't know if there's a limitation on practitioners providing it, because I think that there is some maybe some insurances that don't cover the telehealth. But I don't know how well they're covering it now that COVID's over.
Yeah, I have no idea either. I like the idea of being able to see somebody like, what Amanda was saying about being in a small town and everybody in a small town. So to be able to just go outside of those bounds and get some support without having to drive to do it. It really it levels the playing field in the sense that anybody can have access to a wider variety of practitioners. So that's always the thing I think about, of course, with the benefit of telehealth. Yeah. Any other feedback about any of this? Okay, well, let's go ahead and talk about the second part of the topic.
And Laura, I'll add one note as a tail end of the first bit with the telehealth. We had a little conversation about communication at the board's meeting this past Monday. And one item that I noticed in looking through some of the responses was, some individuals expressed some confusion as far as what is allowed under telehealth, and then also some confusion as far as practicing across state lines, and even maybe a request or a desire for states to allow more telehealth across state lines, or confusion about whether you could or not in certain situations. And so as kind of a reminder, we talked about this at the meeting on Monday, but the traditional method of practice has been for all states to be able to define rules of practice for their own state, primarily because of their state constitutions and their ability to uh, provide safety to the citizens that live in those states. And so that's why states have the sovereignty to figure out, which professions are allowed to practice, what the scope of practice will be, what the license requirements will be. And so historically, that has been why if you wanted to practice in different states, it would require a license in different states. And now there's the push between the multi-state compact to try to get more practice across state lines a little easier. But I think one thing that I took from it in terms of the BSRB is this may be an area where we can share some more information and just kind of let people know here is the reason why you can't practice from Kansas to Missouri unless you have an authorization, because every state has the ability to set their own requirements. And while we might want there to be more flexibility, it really has to do with each state kind of working with the other states and figuring out a process to do that. So I think some people, I think from their comments, may have seen it as it'd be nice if Kansas would allow us to practice into Missouri. And it's like, well, there may be an issue with Kansas, but there also may be an issue with Missouri because you have separate authorities. So I thought that it might be a good area for us to share a little more information. And we talked about maybe putting together a newsletter or some other ways to get information out there to licensees on different topics. And this seemed like one of those topics that would be good. So.
And David, that is an excellent point. And if there was a way to put some information out there about that, so I'll give you an example. We had a client that sees the clinician remotely, and they were going on vacation, and the question came up, well, if they go on vacation outside of Kansas, can I still keep my appointment? It seems like a minor thing, but again, they're outside of Kansas. So do you say no, you got to cancel your appointment, or is it okay because you're a Kansas resident? So I think some of those little details would be really helpful to make sure that people are not accidentally doing something they shouldn't do, because we didn't really know, so we didn't keep the appointment. But I think people can do things and unintentionally violate something. So anyway, thanks for bringing that up.
Yeah.
Yeah.
Go
The
ahead,
other part of that I always think about is professional liability insurance. If something happens, they may not be covered. And that's the other part that we don't really talk about a lot, but is a consideration.
Yeah. Well, and there was I think Florida is the best example I can think of where during the pandemic especially they just said anybody that wants to provide telehealth into the state, feel free. And I think they may have had a registry just to
You had to
try.
register. Yeah.
But there was questionable authority over those individuals. So if something went wrong with them providing care to someone who was in Florida, I don't know that the Florida board would have had any authority to have any kind of punishment for them or restrict them in any way. So that is kind of one of the dangers is when you're talking about public protection, we're talking about ease of access, and I totally am sympathetic to the situations to where someone goes on vacation or you're working with a client and then they go out of state to college and you're wondering how do you continue that therapeutic relationship. It's just kind of a tricky situation. This is, I think, in part why we have an out-of-state temporary permit in Kansas. So if there are individuals practicing at a clinical level in other states and they need to do a limited number of days of practice into Kansas, they can get a temporary out-of-state permit, which allows up to 30 days of in-state practice. And so that is available to people in other states. We've had that in place. I think we had it at 15 days, and then we doubled those number of days to 30 back in 2021, I believe. And so that is something that we offer, but there's no grace period. There's nothing where it would say, you're allowed to just do whatever you want for a week or two. And I think that's probably a good policy not to allow just practice without having some authorization, because then it would be a little uncertain what authority the board would have over those people, and really a way to track them and actually see if they're limiting themselves to the number of days. So,
Michael, what I hear you saying is you'd like for information about that specific type of scenario to be named and to put the word out so people understand.
Yeah, I think again, I don't know who develops that or if we develop that, but I think it would be nice to share that with everybody that's licensed, so they can kind of start learning the rules and the regulations. And because I just find there's a lot of questions around that. And again, I don't think that anybody's trying to intentionally break a rule. I think it's so new to everybody, they just don't know.
Right, right.
it's
Okay.
interesting on the survey responses for certain professions, for the lower level of license, when we asked, how much of your work is done remotely, there were more choose not to answer. And I was wondering if maybe some of the people picked choose not to answer because they were doing telehealth, but they weren't sure if it was okay for them to do telehealth. I mean, we don't we don't restrict them in terms of that from the BSRB. But I wondered about that. I saw that there were a few people who marked that, and so I think there is some confusion. And I think we could provide some more resources to help people have a better understanding.
Okay. Thank you for that. Any other feedback about telehealth? I thought I heard someone beep in. Or try to talk.
Sorry, they're doing some work out here, so if you hear
Oh,
some
okay.
beeps, that may be on.
I heard. Okay, well, let's move on to our second topic.
Okay, and this would be the topic of artificial intelligence. And the question we asked on the survey was, do you currently use artificial intelligence in your practice? And if you do, in what areas do you use AI? And for the LPCs, there were 274 responses. For the clinical level of professional counseling, we had 442 responses. So good feedback. And I'm curious what your takeaways were going through the summary information and then also looking through those appendices, which start towards the back of the report on page, looks like 80. So about 80 to 86.
A lot of no's, a lot of using it to conceptualize things. Um, mostly no's, right? Mostly not yet, not sure, not yet.
Um, I don't think it's going away.
Yeah.
And it's a hot topic right now. Uh, at all the meetings I go to in the agency that we're in, we're starting to pilot two different softwares to help with completing notes more effectively and quickly and professionally. Um, Up till now, we've never used artificial intelligence for that type of stuff. Um, I've never used it. I'm not against, I guess it, but I do see more and more of our new staff asking, do you have this in place? I think I'm asked about this topic probably once a month.
Wow.
Yeah. Staff really want this.
And is the entire session listened to in these scenarios?
Yeah, so it gets, and that's the part I always get, I'm trying to learn as much as I can about, because the software, it basically listens to your session and organizes the note in the EMR, and then the staff goes in and adjust it, whatever they think needs changed to meet the treatment plan. And the couple people that we have testing it, they like it. They feel like it catches the it describes the meeting well, and it makes things a lot quicker. I've talked to different companies that say that this is HIPAA compliant. That's always a concern for me.
Right. Sure. Has your staff that uses it had any, are there any downsides they've reported?
Not really. I think the biggest downside that they say is just the time it takes to go, because you still got to read it, you still got to adjust things in it. It's not a human, so there might be certain details they have to change. But so far there hasn't been any big issues that they've brought up.
So it is
Michael, I think your point on HIPAA compliance is the best one. I am consulting now with two large hospital corporations in my retirement. One of the things that they've limited it to is to make sure that their dictation system, whatever you want to call it, is HIPAA compliant, and that it's solid and protected, and that this AI piece wraps into that and comes out of that. So the only way to keep it confidential or not open to any hacker, I think you're focusing on the HIPAA compliance is going to be paramount. We're also not using it to generate complete reports, but a lot of medical physicians in this company are using it to generate a synopsis of the patient's prior 12-month visits to any practitioner within the system, which also speeds up them coming in. So I'm seeing you for the first time and you're like, well, what do I know about him? Well, let me see what other people have. What does he see the surgeon for, or this for that? And so that printing of the summary they have found to be very helpful. It doesn't go anywhere. It stays in the records as a summary of the record, but they have found to speed up. In fact, the patients like it because they feel like the doctor walks in, knows something about them, which is kind of, instead of regurgitating, how many of us go to a physician and regurgitate everything we said to the physician just last week in another subspecialty? So,
Right.
but the HIPAA compliance is big.
Now, from a business standpoint, not that it matters really for this conversation, but on the business side, and that's what I focus on a lot, is still very expensive. When you've got, we have 200 employees. So if we were to provide that for 200 employees and you pay X number of dollars for each one, it gets really pricey. And of course, one of the arguments we'll often get is, well, they have some free ones out there. Well, that's not HIPAA compliant.
Right.
You gotta pay for the safety as well. So
Has it changed? Have you heard report of it changing how people interact with their clients? Knowing that something is listening, even down to at the end summarizing. So let's summarize what we're doing here. I mean, have people changed what they're doing with their clients?
I haven't asked that question. That would be worth exploring. Are you adapting the way you ask questions or summarize so it picks up the way you want it to sound or organize?
How do I say that soap note out loud at the end of the session?
Yeah.
I'm just thinking, what would I do that would really help me?
Yeah.
I
Yeah,
will, from personal experience, say that I do use it. Mine's on a very small scale because I'm a private practice. And my AI is embedded inside my EHR. And so the risk is pretty much the same as whenever I would do a note traditionally. But the one thing I have noticed that I do different is if somebody tells me that their medication has changed, I say, so let me make sure that I heard that right. You're on this dose of this, because I used to get a pen and a pad to make sure I wrote it down to have it accurately in my note. So now I will say the AI gets it for me, so I don't have to go write it down. And so that would be probably the one thing that I've noticed that I've changed, but most of the time I forget it's there.
Does it remind you when the session's over? Like, or do you get like a summary of all your soap notes at the end of the day, or?
So whenever you go in to do your note, it will say, do you want to use the transcript to attend, like to assist you in scribing the note? And so then you can choose whether or not you want to use it. And then, like it's been talked about, it will generate the note, but then you go through and decide what you want the note to say. So you're still going through and making sure the note is accurate. Yeah, it's just it's almost that idea of like a wordsmith, like it's putting it in those clinical terms for you sometimes.
What percentage of your client notes do you use do you look through it and use the scribed note?
Currently, all of them. I will say it's not as effective, and sometimes I just don't even mess with it if I'm working with a couple, because I think it gets a little confused with that many people. And so sometimes I won't even turn it on with a couple, but other than that, I'll use it with all of them.
Oh. I'm sorry, Michael, what were you going to say? I interrupted you.
Oh, it fell out of my mind, but it'll come back in a minute.
Okay. Anything else? Any other feedback? How do clients respond when you ask, hey, we'd like to use this note taking and, or sign a release and everything? Is anybody saying, I don't want to do that?
I think once they think about it through the lens of like, the note's going to be what the note would have been,
Mhm.
And essentially also I've noticed it being more common within medical practices. And so I think that people are just becoming a lot more comfortable with that. Um, and so, yeah, I think it is just something that people are getting used to.
I haven't
Yeah.
looked at a piece of HIPAA paper when I've gone to a doctor in years. I'm wondering if electronic note taking and so forth has been added to the HIPAA disclosure. Does anybody know?
The HIPAA
Uh,
disclosure
we have
in
to sign.
general for HCA is just once a year. And so on the first visit during the year here in Kansas City through HCA, you sign that understanding note, which buried in all those pages allows them to bill HIPAA notice. And basically what you're saying is, it says I've been offered the HIPAA notice and chose not to receive it. You just don't read that small
Right.
print. If you do say, well, I'd like to receive it, then the clerk receptionist got to do something else to email it to you, which is not very hard. It's a couple of keystrokes.
All right, you're making me, all right, I'm gonna do it.
I remembered my little thought that fell out of my
Yeah.
mind.
Uh-huh.
Um, and I was gonna ask Amanda, 'cause hers is probably the same way, but the one we're using, it doesn't actually record anything. Once you enter the note, it all disappears. It doesn't remember or save anything and send it anywhere. It's just you just use it in that moment. Is that how yours is, Amanda?
Yes, you actually can't even. So say you, in mine, if you go through and use it to generate the note, and then maybe you delete too much and you want it to regenerate it, it won't. Because as soon as it generates that note the first time, it completely disregards the transcript and it's gone. It's destroyed. And so, yeah, it doesn't save any of that either.
That's
I've
good to know.
tested that to see because I'm like, I don't want there to be like some sort of bank of all of these. And so,
Right.
yeah, no, they're gone.
Floating out there. Yeah. Does it do any diagnosing? Recommend looking at this diagnosis or anything?
Ours doesn't do
Okay.
that.
Okay.
It won't even recommend a theory of treatment or any, you have to do all of that. It really is just, I mean, what I think of whenever I think of ethically using AI.
Oh, you just triggered something. This is kind of off the topic, but have you guys ever went to, I believe it's called Cody MD?
Huh. What is that?
This is very interesting. I've used this a few times to play with it. Cody MD is an AI that's put together by doctors all over, I believe, the world in the top of their field. And you can go to Cody, put in your symptoms, and Cody will give you your diagnosis, the three most likely reasons for your problem, and
Wow.
a treatment plan for your problem right there.
Wow.
And it'll allow you to print it out.
So it's literally Dr. Google.
Well, I went in and I did multiple psychiatric ones because I was just interested. What does Cody come up with? And and Cody and I agreed on, all of them.
Wow.
But it's very interesting.
CODYMD.
Yeah, if I remember right, I believe it is CODYMD. You can put it into Google, and it'll pop up somewhere. Yeah, it's very interesting. And it's put
Wow.
together by physicians. And I'm assuming it's on there as a beta test as well, but it's like, wow. Yeah.
Wow. Well, I know what I'll be doing tonight at 3 o'clock in the
You'll be
morning.
playing with that all night. I know.
Most of the comments, to go back to Michael, what you said, were an acknowledgement of I'm not using it yet, but I know it's on the way, or there's this, you know, it has been contemplated by most of the people that responded to our survey. Um, whenever the topic of AI comes up, I always feel this gas and brakes inside of me of I want to learn about it and understand it, and whoa, this is overwhelming and it's gonna still change. And so this topic feels like something that we need to just continue to talk about on an ongoing basis so that we're in front of it and not following it. Fair enough?
Yeah, I mean it's developing so fast that probably whatever we came up with today would be different tomorrow.
And that's the breaks in me. But it's going to change. And I know that's only part of it. We still have to understand it and keep on top of it and stay out in front of it when we can.
Yeah.
I like that, what I heard, the word I like that I heard most was embedded. I like that, what you're using is embedded in an EHR so that it stays HIPAA compliant. To me, that's the most important thing that when I think about our mission of protecting the public, that is absolutely the most important thing. David, any other parts of the discussion that you want to bring up from the survey and AI?
Just a couple comments that I've heard from some of the other advisory committees. We did this as a massive undertaking to survey all 16,000 plus permanent licensees, and so we are going through the process of taking this information and putting it into its final form. But since we did do the survey for some professions earlier this year, I have heard from some individuals that as fast as AI is changing, the comments they made earlier this year when they did the survey may be a little bit different if they were to take the survey today. So I find that to be kind of interesting because I would expect that, in future years, so we could see some change over time. But in this area specifically, some people said, there are people that were very afraid of AI, and now because their hand has been forced or because they've decided to start experimenting with it, they feel much more comfortable with it. And so I find that to be kind of interesting.
Yeah, for sure.
And the AIMB is being embedded into a lot of tools that people use where they may not be aware they're using AI. So I'm happy that we have sort of a few ones that have been highlighted in this list. And when we do finish the comparison report, what we're going to do is if there were any AI tools that were mentioned in any of the reports, we will highlight those in the final comparative report. So we'll have a list between all 7 professions of which AI tools were highlighted by practitioners. So that should be kind of interesting to see.
I would ask those on this committee that are using AI in their EHR to send us the names of the EHR that they use, and if there's specific software or AI tools, to send us those so that we can, make sure that those are being considered and looked at. And the board is actually, we have the same, conversation or similar conversations on a board level. How do we need to be involved in what we regulate with regarding AI? So the topic is developing and evolving. And so anything you have to share is certainly appreciated. And the survey's been very helpful in that regard. All the surveys have. Any other feedback or questions? Well, thank you for this. Thank you for having this discussion and sharing what your experiences are and what you know and what you took away from the open responses as well as the survey questions. It's very helpful, and this survey has, on an ongoing basis, provided a robust set of conversations that are necessary and initially driven by David and by the creation of the survey, but the open-ended questions help to really, make the conversation more robust. So thank you for taking your time to read them and participate. So shall we move on to new business?
Yeah, that sounds great. There was one last item under old business. Earlier this year, we started a conversation on artificial intelligence regulation in general, and we wanted to make sure that the advisory committee had the opportunity to review the question and feedback specifically on artificial intelligence before we kind of wrapped up this item.
Mhm.
And if I recall correctly, it seems like, as I've heard different advisory committees discuss possible regulation changes in this area, it seems like that there has been somewhat of a consensus to include some language about if you're using artificial intelligence, that you provide informed consent to clients so that they know that you're using it, that you are taking steps to preserve confidentiality, um, and then I think those were the 2 main ones, that as a practitioner, it should be your responsibility to make sure that you're preserving confidentiality specifically as it relates to artificial intelligence, just in general, though, too, and then also the informed consent. But if you had any other recommended changes or any points of emphasis that you'd recommend passing back to the board now that you've had a few meetings to discuss this topic, and you've also read the feedback of all the licensees that provided responses, do you have any other recommendations that you'd like to provide back to the board for any requested changes to unprofessional conduct or any other feedback?
Language that says that the practices regarding AI use are HIPAA compliant, I mean, for sure. Anybody else?
That's the big one for me.
HIPAA? Yeah, okay.
Great. Well, I think we can consider this item sort of wrapped up, and we can make sure to move those recommendations back to the board then.
Thank you, David.
Sure.
Okay, let's move on to new business then. Here we go.
Okay.
I mentioned that it's awesome that we have an attorney as the executive director. All the changes that are happening here are the result of very thorough analysis of our statutes and regs. So thank you in advance for that, David.
Well, thanks. And I really do. I need to thank my staff members, especially Leslie. Leslie has really been the historical knowledge for the agency. She's been with the BSRB for over 26 years now, I think. And she's seen every executive director who's ever served the BSRB going back, which is pretty incredible in my mind. And she's seen a lot of changes and knows the history of a lot of these topics. So
Is she on here? Did she jump in?
she is here, and she's going to facilitate a lot of this conversation as we go through the regulations. Um, so
Yeah.
she has seen a lot of the origin for these, but just to kind of reframe why we're looking at these today, the legislature, I think it's fair to say they were somewhat critical a few years back of agencies and how they were handling the regulatory process when it came to putting forward regulations. So when you pass a bill, that becomes either a new statute or it amends the statute, and that becomes law. But within the statutory framework, agencies have the ability to put forth regulations to really be helpful to kind of spell things out. They can't contradict the statutory authority, but they're meant to kind of flesh out the details. And we've had a number of regulations on the books, and the legislature did pass a bill about 3 years ago that put every agency on a rotation. So once every 5 years, beginning next year and 5 years after that into the future, the BSRB I, on behalf of the BSRB, will need to fill out information about each one of our regulations for all 7 professions and basically inform the legislature, is this regulation necessary for implementation of state law? And if it's not necessary, is it helpful? And then answer some additional questions about the history and other things. And so as part of preparation for that, we have brought a lot of regulations to you as a body to review. We brought forward some of the bigger ones first. We did the unprofessional conduct regulation, continuing education, educational requirements for licensure. And so what we have left over are some of these regulations that were put into place maybe 20, 25 years ago that we want you to have the opportunity to review and provide some edits or feedback, or if things still look good, that's okay too. But we'd like to be able to say that over the last few years, all the advisory committees have had the opportunity to review and make edits to any of these regulations. So Leslie and I have reviewed these regulations. We have some proposed edits on some of them. But as we go through them, if you have questions, if you have other edits that you would recommend, we can go ahead and include those as well. So, but we wanted to make sure that some of these are shorter. If you've gone through these, some of these are only a paragraph at times. And so, but if there is a regulation that is no longer necessary, this could also be something that we could get rid of. There's no reason to have regulations on the books if they're no longer helpful or relevant. So that's something we're kind of keeping an eye out for as well. So, but we did give you a packet of about 10 regulations. So what our plan is today is to go through these, and we'll highlight some items for change. And then we will open it up to see if you have any questions or other recommended changes. And then we will ask you, is there a consensus to move forward with the edits? And so if there's no objection or if there appears to be consensus, then we'll just go ahead and move to the next one. So we'll just kind of go through these fairly quickly unless you have questions. So if you do have questions, we can take as much time as needed.
Terrific. Thank you for that.
Sure.
Leslie, I want to thank you for your institutional knowledge. I was cracking up at the all-day planning session because whenever someone said, "How was this used to be? When did this change?" All 18 sets of eyes would kind of glance over your way for what was the answer to that, because you do have that institutional knowledge. So I just wanted to
That
tell
makes
you.
me feel as special as I did when I just found out I was going to become a great grandmother.
Aw.
I'm getting old. Thank you.
And Leslie was incredibly helpful when I first started as executive director, and we've had some really good conversations, looking back at some of these things and trying to figure out, the history and as things have evolved. And so, yeah, Leslie has been an amazing resource for the BSRB.
Sure.
Thank you very much.
I'll go ahead and share my screen here, and we can start with reviewing the first regulation. In your packet of material, you should have copies of these. These are also posted online if anyone's following along. But the first one we're going to talk about here is KAR 102-3-4A. And just one thing I'll talk about at the beginning. These are the regulations for the professional counseling statutes. The word fees is on the top of each of these regulations. It should not be. We don't have any control over that, but we will possibly make a request that the word fees be struck, because really all of these regulations relate to professional counselors, yes, but not all of them relate to fees. So thought I'd head off that question in case you see that on multiple ones. But this regulation really relates to the applications for licensure. And so when someone applies for licensure, there is some guidance in the statute, but the regulation really goes into more detail about is required. And so, like I mentioned, Leslie has had the opportunity to review this, and I've marked something on here as well. So why don't we go ahead and start with Leslie, and you can talk about if you see any items on here that you'd recommend edits.
So the first one would be in C6. For the LCPC applicants.
And which number was this?
Little c as in cat. So
Okay.
down the next page.
Okay.
So it is old language saying that they have to have 350 hours of direct client contact in their practicum and internship. So we need to change that to 280. But additionally, we need to adjust the language, and it's written in another reg already, but we need to adjust the language to say that if they didn't have 280, they can make up the difference rather than completing the whole amount again. So that would be the change. And then the 4,000 hours needs to be changed to 3,000 hours.
Okay.
And then further in E, 1 and 2, they both speak to a 6-month temporary license, and it needs to be changed to 24 months. And then that was all there. And then in G, it talks about extenuating circumstances. And I think that should point back to our definition regulation rather than repeating it, because if we change the definition and we don't change it here, it won't match.
Yep. I agree.
Yeah, you had them all.
Good catches and good edits. Does anyone have any questions about these edits or any additional comments or edits you believe would be helpful for this regulation? If not, is there consensus to move forward with these regulations and submit them to the board?
Yes.
Okay.
Any
And-
opposed?
Okay, appears to be consensus, so we'll go ahead and submit those to the board. And like I said, we'll go through these fairly quickly. And this is just because most of these are somewhat helper regulations that just kind of talk about some of the technical procedure. So, but if you do have questions, feel free to let us know and we can answer any questions. So we will move to the next one, and that is KAR 102-3-4B, application for licensure based on reciprocity. And I'll go ahead and turn it back over to Leslie, and she can say if there's any items that caught her eye for edits on this one.
So, as we discussed in a previous meeting, the statutes for reciprocity have been amended. And so we're still needing to update the regulation. The main, big change is that, let's see, that the ways to qualify for reciprocity have changed. And so now they have to either have met substantially equivalent requirements or have to have been licensed for 1 year with a similar scope of practice. And in addition, there is no requirement for practice during that time. So it's just substantially equivalent or 1 year of license at with a similar scope of practice. And then all of the other things, like for the clinical license, those options remain the same. So that's the big change in this.
Okay. And for those of you who are relatively recently added to the advisory committee, just a little bit of history. The board has had a statute in place for several years that allowed individuals to become licensed here through a path we call reciprocity, when you're licensed in another state or jurisdiction and you want to become licensed in Kansas too. Originally, that statute did talk about 5 years of practice, and then it was changed to 48 of the past 54 months. And then back in, I believe, 2021, there was a bill that passed which was not called universal licensure at the time, but since has been referred to as a universal licensure bill. It dealt with applicants that were seeking reciprocity that were military members, military spouses, individuals that reside in Kansas, and those that intend to reside in Kansas were later added to that bill. But it changed and created a different path. But it also was confusing for some people, let's say, that lived in Missouri, because they wouldn't have qualified for that because they weren't military members, military spouses. They didn't live in Kansas and they didn't intend to live in Kansas. So they wouldn't have qualified for that shorter time period for reciprocity. So in the bill that passed in 2023, the board put forward some recommended changes that the legislature did pass and adopt. And part of that was to change the main reciprocity statute for the BSRB for most professions down to a 12-month time period to match the time frame from that military reciprocity bill. So this, as Leslie just said, kind of syncs it up. So instead of it referencing 5 years or 4 years, it'll reference the 1 year period that the statutes say. Were there any other items you saw as recommended changes in the regulation?
I don't think so, no.
Okay. Well, any members of the advisory committee, do you have any questions, or were there any items that any of you saw as recommended changes?
I didn't have anything. This is pretty straightforward.
Yeah, just kind of cleanup work. Is there consensus between all of you to go ahead and move this one forward to the board for board review?
Yes.
Okay. Looks like there are a lot of head nods. It seems like there is consensus. So
Anyone not agree? Okay, thank you.
well, we will move this one to the board and we'll move on to the next regulation. So next in your packet, you should see a copy of KAR 102-3-5A, and this regulation deals with examinations. And so I'll turn it back over to Leslie. Is there any language in this regulation that you would recommend to be changed?
No, it has both levels, and there's no nothing that I saw that should need to be updated.
Okay, I didn't see any edits here either. Any members of the advisory committee have any questions or any recommended changes for this regulation? Okay, since there's no changes, we can just make a note in the minutes that this regulation was reviewed by the advisory committee, and it was a consensus to basically keep the regulation in place without any changes. So we'll go ahead and move on to the next regulation here. The next regulation is KAR 102-3-9A, and this deals with renewal and reinstatement. And I'll turn it over to Leslie. And Leslie, did you have any items that you'd recommend for edits?
So in B as in boy, I thought we need to do an update to the fees to show that if it's less than 1 year, it's got the late fee. And if it's over 1 year, it's just the renewal fee.
And I'll just say, just to kind of clarify that for the advisory committee members. So historically, when someone had a license and the license expired, if they wanted to reinstate their license, come back to practice again, they would need to pay essentially a renewal fee and then a second fee, which was equal to the renewal fee. That second fee is sometimes called a reinstatement fee. It's sometimes called a penalty, but basically they would need to pay the two fees to come back. As a way to help with workforce back in 23, one of the initiatives the board pursued was if there was someone that had stepped away from the profession, allowed their license to expire, and it had been longer than 1 year, their license had been expired, as a way to help motivate them to come back and practice again. If their license had been expired for over 1 year, they would be able to get their license reinstated for half the cost. And so there was a discussion of just doing this for everyone. But I think for individuals who have an active license, we didn't want them to become we wanted them to make sure that they renewed their license on time. And so that second fee was basically to ensure that people really did stay up to date on their license and didn't practice with an expired license and things like that. So within the first year, you do pay both fees if you want to reinstate. But for people who were coming back, and this was in mind for people who've walked away because of their own health, or maybe they had professional burnout, or they wanted to start a family, or different things like that. This really was to motivate people who'd come back after a length of time. So what Leslie talked about is making the adjustment here to reflect that there are two different fees based on how long someone's license has been expired. And
And
then,
then, oh, go ahead. I was
uh,
going to say, and see, I see you just struck that bull, and who thereafter applies for renewal of license. I was going to say it needs to, at a minimum, be changed to reinstatement, but just striking that section works well
yeah, so
because they're reinstating, not renewing.
right. And I felt like this language was a little bit confusing because it did say if someone had a license that had expired, and then it makes references to them either reinstating or renewing their license. And that really doesn't make sense with the way that our statutes are set up. If your license has been expired, you can no longer renew it because it's not alive anymore in a sense. You would need to reinstate it. And then after it's reinstated, when it comes up to expiration in the future, you could renew it before it expires. But renewal doesn't happen after a license expires. It's really reinstatement to get it back into an active status. So striking this language about renewal after expiration seems to keep things consistent with the statutes.
And then I thought we should also maybe add language about the availability of a reinstatement temporary license if their license has been expired over 1 year, which was part of the same bill, I believe.
Yeah. And for the new members of the advisory committee, that was also something the board pursued back in 2023. If you are reinstating your license, one of the requirements is you have to have completed continuing education hours for one license period within the last 2 years. And so for individuals that wanted to come back and practice that had not done that, that was seen as somewhat of a barrier. And so to assist those individuals to be able to come back more quickly, the board created a 6-month temporary reinstatement license. That's what it's called. And that 6-month temporary reinstatement license allows someone to practice under supervision for up to 6 months while they are finishing those specific CE hours. And once they have finished the hours, they are able to apply for their license to be fully reinstated, which allows their permanent license to be reinstated. But this gets them back in the door, hopefully as a way for them to make some money to pay for some of the cost of those CEs. And then that way they can provide services, have the money for the CEs. And then when they've finished that requirement, then they can get their license permanently reinstated. So, any other items you saw in this regulation?
Not that needed to be changed, but I did like the clear direction provided in this regulation for reinstatement after suspension or revocation. That
Mhm.
is, it is not in all renewal regulations, and I thought it might be something we want to look at to add to the others.
It's a good idea. Yeah. Okay. Well, thank you, Leslie. Any other members of the advisory committee, did you have any comments or questions or any other recommended changes for that regulation? Okay. If not, is there consensus to move forward on this regulation and forward it to the board? Okay. There appears to be support. As Laura mentioned, are there any objections for this one moving forward?
That's usually easier to see. Someone, no.
Well, I don't see anyone frantically waving their arms in protest, so I think there is consensus, and so we'll move this one forward. Thank you for that. We'll go to the next one. Okay, moving next. This is a short regulation, and this is KAR 102-3-17. It says it's the definition of a day. And basically, this regulation, I believe Leslie and I had talked about this regulation. It links back to a statute that really no longer exists. And the definition of a day for other purposes is defined in other sections, like when we're talking about a continuing education, or when we're talking about a temporary permit. I think we have some reference to that. So, Leslie, did you have any thoughts on this regulation here?
Mine was really that it could either just be revoked, or is it revoked or repealed for a reg? I'm not sure.
I think probably repealed. Yeah.
Okay. And then or if we wanted to keep it to say 24 hours, we could change the language to point to the definition of a day for a temporary permit.
Mhm.
So
Yeah.
either way.
Yeah, and I think on this one I agree with you, Leslie. I think this one could easily be repealed. The underlying statute that it references, I don't think that statute actually still exists. I think it linked back to a previous thing that had been removed. So I think on this one it may be just the cleanest to go ahead and repeal it. But any questions about this one or any other requested changes?
I can't think of a reason to keep it.
Yeah.
Yeah.
Well, is there any objection to moving it forward as a regulation to repeal? Okay. I don't see any opposition, so we will inform the board that that would be one that we would recommend they authorize us to go ahead and repeal.
Great, thank you.
We'll move on to the next regulation. All right, this is KAR 102-3-9B. This is the regulation for the renewal audit. And I have one minor edit here, and that just has to do with striking the word original. So if someone is selected for audit, it does note that they would be providing the board with certain documentation about completion of their continuing education hours. In section C2, it says they'll provide the original continuing education documents that validate those hours. We don't need the original documents. We do most things electronically now, so striking the word original seemed like a tidy edit. So, Leslie, did you have any additional edits that you would put in here?
Just the adding language that says if they have, and I know we wouldn't use CE broker, but if they have an account where all their continuing education is stored, that we would check the account. They wouldn't have to fill out the forms.
Yeah, that's a good question or a good comment.
Yeah, good point. Do all of you
because-
know about CE broker? I assume everyone does. I've had a lot of good feedback from people that contact me saying they like it. It's a good place
Good.
to store everything. Yeah.
If
So,
I
yeah,
was licensed, I would use it.
mhm. Yeah, then it's there and I don't have to worry about it.
I just recently got feedback from one of my staff that he hadn't used it, but saw that that was an option because he got randomly selected for audit. And so he went in there and put everything in. He's like, that was so much quicker.
Oh, good. Oh, good.
That's good. It's good to hear.
Good
Yeah.
to know. Right. Yeah, tell them to spread the word. It's easier for everybody. It was one of the easiest things for David to really find and implement because it's a win-win. There, we couldn't really find any negative reasons to do it, to not do it rather.
Well,
Yeah.
and that goes along with you striking the original document. Really appreciate you removing that because that's caused some confusion.
Yes.
Like, can I email them? Can I send them? Can I upload them if they have to be original? So appreciate that.
We've also, if you get selected for audit, you'll find we have changed our cover letter and said, please only send copies or email them for that reason. And because we
Okay.
have had people who send their audit materials with their originals and it got destroyed in the mail. And
Oh,
so then if they need it for another state or for something else, they didn't have it. So we would prefer not to have to deal with the originals anymore.
gosh.
Well, any questions on this one or any additional requested changes for that regulation? If not, are there any objections to us moving this forward to the board for their review? Looks like there's no opposition, so by consensus, we'll go ahead and move it forward. We've got a few minutes left. I think we should be able to at least address the remaining regulations. There is probably going to be one that I will ask you maybe to see if you're comfortable with talking about it today or if you'd like to look into the statute. And that is probably this next one here. This is KAR 102-3-14, licensee consult with physician when determining symptoms of a mental disorder. And if you are not familiar with this regulation, it does link back to an important statute that kind of gives the reason why this regulation exists. We don't talk about it very often, but it is a common regulation across the professions. But like I said, we don't really discuss this one very much because it doesn't really come into play. We don't get a lot of questions about it. But if you are not familiar with it, we could table this one for you to consider at your next meeting. But before we do that, Leslie, did you have any edits you'd recommend for this regulation?
No, my suggestion was that the committee look at it.
Yeah, and it, like I said, it does link back to the statute, and our ability to change the statute is somewhat limited. So, but would you like some additional time given uh, some of the unusual nature of this regulation to review it a little bit more so you feel comfortable with it?
Yes, please.
Okay, then how about we go ahead and table this one, just go ahead and plan to review it more, and then we can discuss it a little bit more at the next meeting.
Got it.
David,
Yes.
you said it refers back to another statute. Is that the 65-5804?
Yes.
Okay. So
Yes.
when we study this, we need to study this along with that 65-5804.
Yes, and I believe in preparation, I went ahead and looked through these ahead of time, and I think that statute deals with a few different topics. So I think the relevant language is towards the bottom of that statute. So just go ahead and take a look at that. It'll stand out if you're looking for something that would connect with this regulation. But I think you should be able to identify the relevant language. But go ahead and take a look at 65-5804.
Okay. Thank you.
We'll table this for now and we'll move on to the next one.
Scroll
Unless,
down a little bit there, or is this just a picture?
I'm sorry.
I was looking at the statute to try to find the subsection.
Mhm.
But I can't see because it cuts off the history, so never mind.
And it looks like the last time this was edited was back in 2000.
Okay, so it only lists, I was making sure that it only listed 5804.
Oh, as far as the authorizing and implementing
Yeah.
statute? Yeah, it
Yes.
looks, yeah, if you're not familiar with reading through some of this important language here at the end, if a bill is passed, it would basically say under what allows the board to do this regulation. And this 74-7507 is sort of a general authorizing regulation for the board. However, if there's a statute that it would connect directly to, it says sometimes implementing this essentially the bill that passed that became law. And so the bill that's really relevant specifically to this language is that 65-5804, that KSA. So you can pull that up from our website. Alternatively, you can do that from the Revisor of Statutes website, but it looks like that passed during the 1999 session and then was made effective, it looks like August 4th in 2000. So. But we have two left and they're pretty short. And one of them is KAR 102-3-15. And this is one that you're going to see across the professions. It references that the professions follow the DSM 5th edition. And we've had some discussions with the other advisory committees that although it is still on 5, it is not just 5. I think the DSM is, Leslie, do you recall the version number?
It's 5TR.
Yeah.
So,
I
this-
thought in the beginning they said they weren't going to do that, but it was going to be electronic updates. But anyway, there is a new book. I've seen it in the office.
Yeah, we don't have the book. Our forms are all electronic now.
Yeah,
so for consistency, I think we would recommend updating it from 5th edition to 5th edition TR, just to be consistent with what is the current standard.
Would it be an option to say the most current date, the most current version of the DSM?
It would be, but I think that the legislature has been resistant to that in the past.
Okay.
I think there have been some versions where certain things that were considered impairments at one time were not considered impairments at other times, or certain language changes that gets a little bit political here and there. And so I think that's why they wanted to have this be very specific and have some oversight in terms of what was being adopted. So
we'll just have to go back in and change it as it's updated.
I think so. Yep.
Okay.
And then I know we're really close on time, but we have one last one. Or actually, is there consensus to move forward with 102-3-15 with that recommended adjustment?
Yes.
Any objections? Okay. Appears there is consensus there, and I'll just do the last one real quick. The last one is a regulation, KAR 102-3-16, services rendered to individuals located in the state. And it basically says when we're looking to see if someone is engaged in the practice of professional counseling in this state, they shall be required to have a license issued by the board to practice professional counseling or clinical professional counseling. If they perform a service to someone where the individual client is located inside the state at the time the service is being provided, or if someone represents themselves as a licensed professional counselor or a licensed professional or clinical professional counselor. And so both of those things would be considered in-state practice in terms of this regulation. And this is one that you'll see across other professions as well. So I didn't have any recommended changes. Leslie, did you have anything for this one?
no.
Okay. Any questions from members of the advisory committee or any recommended changes?
Pretty
If-
straightforward.
Yeah, I think this one is good. We can kind of say we looked at it, it looks good. So their consensus to go ahead and just leave it as it is. Okay. Okay. Well, thank you for your review. We'll come back to the tabled one next time, but I do appreciate your work on that. Just wanted to make sure that you had the opportunity to review these and then have the opportunity to ask questions. We do ask you to review the statutes and regulations, but I realize that some of these don't get a lot of attention from time to time. So thank you for your work in preparation, and we'll revisit the one that we tabled until next time.
Well, thank you, David and Leslie, for looking at them, analyzing them, and making the appropriate changes and recommendations as well. Thank you.
Thank you.
So thank you, everybody, for all the time you take to really take into consideration thoughtfully what we're doing here. I just, every time I work with all of you, I'm so grateful for your time and your talent and your experience. So thank you so much for all you bring to these meetings. Our next meeting is October. No, that's not our next meeting. Our next meeting is December 4th at 10 o'clock. So that will be our next meeting. And if without any other questions or concerns at this moment, I would need a motion and a second for adjournment.
So moved.
Thank you, Michael.
Second.
Thank you, Vanessa. Okay. Any opposed? Okay, then we're out of here. Have a nice Thanksgiving. We won't see each other until after that time. So here we are into the holidays. Have a great and
Already.
I know who knew. I went in Home Depot the other day, and when I saw Christmas decorations, a wall of Christmas decorations, I went, nope, and I walked right out. But have a nice Thanksgiving, everyone.
Thank you, everyone.
See you later.
Bye.
Bye. Thank you.